everybody thinks that carbohydrates are an essential nutrient. It's very difficult to switch to a diet like this until and unless your environment also kind of is conducive for you to, follow the diet. So accessibility, budget, these are a few challenges that we face here. But I think mainly the main challenge is the idea that it can cause heart disease.
Over 2 centuries ago, its use, so a meat-based diet, so essentially a low carbohydrate meat-based diet for the treatment of diabetes, and it worked remarkably. Its concern around cardiovascular disease largely has arisen because we now have the ability to measure blood lipids. And since the emergence of measurement of blood lipids, we've seen this association with particular blood lipids like LDL cholesterol. Diabetes has tenfold higher risk for cardiovascular disease. So this concern around LDL cholesterol isn't invalid. It is a risk factor, but it's a risk factor with infinitely less risk. We should be focused on glycemic control first.
Right.
Then things like blood pressure, triglycerides, which, by the way, low carbohydrate ketogenic diets are very good at improving for people. Right. It doesn't mean it doesn't matter. It just matters a lot less compared to these other metrics.
When we do the lipid profile, when we repeat that after a month or so of the client being on the diet, we realize that when we check the lipid ratios, when we check the changes in the lipoproteins, it's a favorable outcome or a more favorable profile than when we started. Definitely the triglycerides drop, so that is a good sign.